In this tutorial, we're going to be talking about 5 different reasons to stop doing sit-ups and crunches. I've got some notes just to my left here, so if you see me looking over, that's me reading those notes. I've got some different texts from some different books, so I want to be able to get them right, say them correctly, and then I can expand on them. Number 2, the psoas doesn't deactivate when you bend your knees. So people say if you bend your knees, you won't get as much psoas activation, but this has been found to not necessarily be as true as these people are making out. So it doesn't deactivate with your knees bent, and it does compress the spine. So not only does the flexed posture do it, but also the activation of the psoas does it as well. And this comes from low back disorder by Dr. McGill. It is true the psoas is shortened with hip flexion, but its activation is actually higher during bent knee sit-ups. This is because the hip flexion torque must come from somewhere, and the shortened psoas must contract to higher levels given the length. And he then goes on to talk about it's not necessarily, so whether it's straight leg or bent leg, it's not necessarily the type of sit-up that I guess shouldn't be done. It's sit-ups that shouldn't be done for most of the population, because we know that most of the population are going to experience lower back pain in their life. It's not necessarily a good mechanical position to be in anyway. Therefore, most people don't need to do it, and in my opinion, I don't really think anyone needs to do it. I don't see it as a necessary exercise. There are plenty of other exercises out there that can improve the way your core works and stabilize the spine without flexing it. So it's just an exercise that I always say there's no real necessity for it. Number 3 is sitting up and twisting. So some people use them as like a bicycle type thing where they get the legs going as well. They think that there will be some sort of greater muscle balance or greater muscle activation that is going to help build the core and spare the spine, but unfortunately, again, this isn't necessarily not only the most effective way to train, but also it's not necessarily true. So if we go back to low back disorder, these result in a poor ratio of oblique muscle challenge to spine compression compared to the side bridge. So what's happening there is you're getting high muscle challenge and high spine compression. Whereas when you do the side bridge, you'll be getting a high oblique challenge, but you'll be getting a low spine compression because your spine is in a much more effective posture. So it's challenging the muscles, which is what you want, and it's in some respects, it's sparing the spine, which again is exactly what you want. So we're getting the high muscle challenge, low spine compression with the side bridge, and we're getting the high muscle challenge and high spine compression with those curl up sit-ups with the twist. Number 4, it doesn't strengthen the core. What these exercises are doing is they are focusing on individual muscles, let's say. So with the curl up, we're trying to activate and get high activation from the rectus abdominis, not necessarily from the obliques. As we talked about with the curl up and the twist, with the obliques, we're getting that high oblique challenge, but we're also getting that high spinal compression. Now, when we talk about core training or core exercises, we want to get much more of a muscle balance. Now, as we've talked about with the side bridge, we get that muscle balance with the obliques. If we then go into a plank, it moves around into the rectus abdominis. So if we combine those two exercises, keep them in a good ratio, then we're going to get much more muscle balance from it. Plus, we're going to be minimizing the compression through the spine. So we're going to be building the core and sparing the spine, which when we are trying to rehabilitate lower back pain is the ideal sort of ratio or balance that we want with regards to muscle activation and spinal compression. And number 5 is that these movements or exercises, if you want to call them that, the sit-ups, the crunches, even the lateral bends as we talked about in number 1, these spine bending exercises, they don't replicate movement. Now, the core works properly when we are during movement. So we can have strong abdominal muscle, so we can have a strong rectus abdominis, but that doesn't translate out into everyday movement, which is what's going to protect our spine. So a lot of people then will sort of throw at me the argument, well, why do the army use it, or why does the military use it, or whatever? Well, in recent times, this is all now starting to change, and it is the U.S. Army which are now starting to move away from this challenging the abdominals to more task-orientated movements, for example. So it says the US Army are phasing out the sit-up test for more task-orientated tests like a deadlift, which is lifting. So lifting an object from the floor. Now that could be a heavy box or it could be a person. We've also got throws. They've also put in drag and carry moves. So we're starting now, or they are starting now, to look at what are the predominant high challenging movements that they need to perform, that they need to have competency at. And they're finding out that it's lifting, throwing, dragging, and carrying. So instead of just saying, right, you've got a strong or highly endurance in your rectus abdominis, we now need to think that doesn't matter. What matters is, can you lift something, can you carry something, can you drag something, and can you throw something with competency? And is that going to keep you fit and keep you healthy for the job that you need to do, not the sit-ups, which is only going to cause high muscle challenge and high spinal compression as well. So those are my 5 reasons to stop doing sit-ups and crunches, and even if you want to throw that in there, lateral bends. I hope it's been helpful for you. I hope it's given you a better idea of not only other exercises to do, but some reasons why you shouldn't be doing the sit-ups and the crunches. So many thanks for watching. My name is Chris. I'll speak to you in the next tutorial.